Hey, how you doing?
Hi.
My name's Rick. I'm a student nurse. I've been assigned to you today.
Okay.
That's awesome. Do you mind if I go around and kind of
Sure.
observe you for a little bit?
Mm-hmm.
Can I get a SBAR report on your patient?
Sure. So, who we have here is Mr. Levi Restivo. He is in room 620. He is a 67-year-old male. He's a full code. His doctor is Dr. Phillips. He has allergies, so that's really important that we pass that on to tetracycline, dog care, and peanuts. He's here today because he has a stage 2 diabetic ulcer on his right heel. And he also he came into the office because his blood glucose was elevated over the course of 5 days, around in like the 300s. So that's really important for us to know. He also had an elevated A1C at 8.2. Currently, we just treated him for his right heel pain. We gave him some morphine because he was complaining that it was like burning, and he rated it about a 6, but now it's about a 1, and we've been watching his respers, and he's fine. So we'll just keep an eye on that.
Okay.
He is alert and orientated times 4, a little anxious, but that's to be expected. Both pupils are Perla, and he wears glasses. His lung sounds are bilaterally clear, even and effortless. All his pulses were good, upper and lower extremities, 2 plus regular. Cap refill was normal, less than 3 seconds, and he has no edema present right now. His bowel sounds are active in 4 quadrants, and something important is he has an 800 calorie diabetic diet with 2 grams of sodium restriction. So
Okay.
if we're
I only
giving him
have
food,
800.
no, 1800.
Oh, 1800. Okay.
Yes, 1800. So we just need to keep an eye on that today. His last bowel movement was today, and he voided today, both normal in appearance. So he has a 20 gauge IV in his right forearm, which was put in today. We're going to hang some maintenance fluids today, just normal saline. Saline, yeah.
Sailing? Yeah.
The doctor's orders today was just maybe do a chest x-ray. He consulted wound care to make sure that bandage is getting changed. PT/OT case management was ordered, and then possibly diet education as well. His last set of vitals were somewhat normal. He did have a little bit of a fever at 100.1, so we're kind of keeping track of that. It's most likely because of his infection.
Okay.
Do you have any additional questions?
No, you're going to be doing some med pass here, right?
I am.
All right. Yeah, I have a few questions about those when you're ready.
Sure. Let's get those out of the
All
way.
right. So the medications you're going to be giving, what specifically is the client receiving these medications for?
So we're going to be giving him 3 meds, and I'll talk about them each individually. The first one we'll be giving him is his Vanco. He's receiving this med because he has that ulcer on his right foot, and Vanco is going to help heal it and fight that infection. It prevents the bacteria from binding to the cell walls, so it creates the bacterial death. So in turn, the infection goes down. And then for his insulin, he is a type 2 diabetic. And he receives insulin all the time at home based on his blood glucose, so that's really important for him. His current blood sugar was 290, so we'll be checking that in a little bit to make sure how much we will be giving him. But the insulin itself, the action on the body is it stimulates the glucose, it facilitates the glucose into the cells, so it lowers the insulin.
Okay.
And then the third med, sorry, I was thinking, is his lisinopril, and that he's receiving that because he's had some issues with his blood pressure being a little elevated. So he's been on that for a while as well, and that just basically lowers his blood pressure. But specifically, lisinopril is an ACE inhibitor, so it prevents that conversion of angiotensin 1 to angiotensin 2 that happens in his lungs, and that causes vasodilation, which decreases his blood pressure. So
Okay.
did
Awesome.
I cover those 3?
Yeah, so you talk about why he's getting it and the actions on the
Mhm.
body. When would you want to question that medication? And is there like a serum level you're looking for, like vital signs you need to monitor, physiological parameters you got to check, anything like that?
Those are good questions. So for Vanco, we should question Vanco. So with Vanco, you have to check these things called peaks and troughs, and you should question it. If either one is out of sync, we would just question the amount. Also, in somebody who has renal impairment, you would want to make sure the dosage is correct, along with somebody who might have hypersensitivity towards that drug. As for vital signs for Vanco, nothing specifically. We'd be checking those serum levels of BU and creatinine. The peaks and the troughs are the main big hitters for Vanco. And what those basically lets us know is if it's too low, we give him a higher dosage. If it's too high, it could become toxic, so we need to lower our dosage for the next dose. Yeah, so that's, did I answer all those for Vanco?
Yes.
Okay. And then for his insulin, the most common thing that happens with diabetics is hypoglycemia. So that would be the number one thing we would check first is if he was hypoglycemic. And if he was, that's when I would question it. Also, if he hadn't had a lot of food in a while, I would question giving it as well. There really isn't a therapeutic level for insulin. We would just be checking his blood sugars routinely, Q4 hours before meals. And so if it was too low, we would hold it. If it was too high, we would use a sliding scale.
Okay.
And then last but not least, the lisinopril. I would question giving the lisinopril if he was hypotensive, because since that is a blood pressure, it lowers your blood pressures. You wouldn't want to give somebody it if they already had a low blood pressure, because that would bottom them out. So I would definitely question that. We'd be monitoring his, for vital signs, blood pressure, heart rate, all those things. We would be monitoring those frequently. Let's see, we would, for like a serum level, there really wasn't a serum level, but we would also take a look at those renal functions and those electrolytes as well to make sure everything is good for that.
All right, excellent. And then, are there any interventions that you need to teach the client to ensure the medication is administered safely in the hospital or at home?
So for Vanco, it's only given through an IV, so he's not going to be going home on it. So we'll do some patient teaching in a little bit, but for the purpose of hospital education, we would educate them about those peaks and troughs, so that we're going to be drawing labs frequently to make sure they're not toxic in his levels. We would be monitoring his IV site so he doesn't have phlebitis, because it's a very harsh drug we'd be giving, so we'd be monitoring that a lot, and just monitoring his like white blood cell count to make sure that it's working. But as for that goes, yeah, there's not really much education for home purposes. For the second med, he gets insulin a lot. So he could probably teach us a thing or two about insulin, but we could always reiterate education because it's so important. So it's going to be the same for home and hospital, educating them on the signs and symptoms of hypoglycemia, to make sure that they know how to check their blood sugar routinely, make sure they have like a machine at home that they can check it, that they're rotating those injection spots so they don't have lipodystrophy, which is like the accumulation of like the fat. So he can rotate this spaces on his stomach or back of the arm. So all of those kind of are the main things that we would maybe more so reinforce that we can implement here in the hospital as well. Sound good?
Yep.
And then the last one, lisinopril, he takes that at home, like I've already said, but just making sure that he, here in the hospital, that he's not hypotensive. We would check his blood pressure, make sure that he isn't dizzy upon standing, reinforce signs and symptoms of dizziness, and then just making sure that he is okay, and if he has a persistent cough, that he might need to contact his healthcare provider.
Okay.
But other than that,
And then I think you already hit on it, but the side effects and potential adverse reactions, you talked about a little bit.
yeah, a little bit. I've mentioned it, but the most common one for Vanco is, you're going to hear this a lot, is the red man syndrome. It's a flushing effect that happens all over their body, so we need to make sure that does not happen. Ototoxicity and nephrotoxicity, that's why we're checking those BUN and creatinine levels, so he doesn't have, his kidneys aren't affected, or his hearing isn't affected, or sight isn't affected. Now for insulin, the side effects, the main one is hypoglycemia again. It's the most common one. The other one, like I kind of already told you about, was the lipodystrophy. It's the accumulation of fat, swelling, redness, irritation at injection site. For lisinopril, it's more of being hypotensive in a state. Angioedema is huge with that one, which is like the swelling of like the face and could become deadly. So we would want to make sure that they understood that. And then that persistent cough is one of the most common things as well with the ACE inhibitor.
And then how would you know when the medications are effective?
Okay. No, these are great questions. We would know that they were effective for the Vanco with monitoring his white blood cell count. If it's starting to decrease, then that means the infection's starting to go away. So we would know that it's working by looking at his labs and looking at the site itself. If it's starting to decrease in swelling, there's no signs of infection, those are all good signs that that one's working. For insulin, we know it's working if his blood sugar comes down, and not just comes down, but it's controlled over a long period of time, and it's a consistent controlled level. So that's how we know that one is working.
Okay.
Same thing with lisinopril. If his blood pressure decreases with no side effects over a long period of time, and he's come back to his normal, that's how we know that that blood pressure med is working as well.
Awesome. Sounds good.
Any more questions?
Nope, that's not right now. Thank you.
Okay, so we'll go ahead and wash our hands and then go into the room. I'll introduce you and we'll start our med pack, okay?
Alrighty.
Okay. Mr. Restivo, I have a student here.
Oh, hello.
We're just, if you don't mind, I'm just going to show him what a med pass looks like. We're going to be giving you your 3 meds, the Vanco, the insulin, and the lisinopril. First, I would like to, I know you're kind of confused of why you're getting the Vanco.
Yeah.
You've never
I
had that
diabetes.
med, right?
Yeah.
Yeah. Well, so the Vanco, here, I'm going to go ahead and give this to you.
Okay.
It's a little handout that we like to give and educate our patients on about side effects, what to expect. It's things that we want you to be educated on. The main one that I want to point out, I highlighted them for you, is the red man syndrome, the flushing, the those are the 2 big ones. And if you're starting to feel dizzy or anything out of the normal, go ahead and let us know. I'm going to hand that to you, and then after I give your meds, I want you to be able to teach back to me so you are well educated on that topic. Okay? I want to ask you, do you have any pain or nausea right now?
No.
Are you comfortable?
I'm comfortable.
Okay. So we'll just go ahead and start off with giving your meds. And if you have any questions, you let me know, okay? So, level 1 student, it is important to go ahead and check his 2 identificators. Mr. Restivo, can I get your name and age?
My name is Levi Restivo, and I am 67 years old.
Awesome. And do you have allergies?
I am allergic to, what am I allergic to? My little red band says it. It says tetracycline, dog hair, and peanuts.
Great. So
Not the food, the cartoon.
Oh, goodness. So if you want to take a look here, I already pulled up on my screen to make a point at this. He is, in fact, Levi Restivo. He is 67 years old. And these are all the things that he is, in fact, allergic to. It's a tetracycline, dog hair, and peanut. So if it's not in the MAR, you can usually find it somewhere in his chart. But we just want to make sure that's double-checked before we give meds.
Okay.
So we'll go ahead and go to the MAR and pull up the meds. I'm going to go ahead and first hang all the IV stuff. We'll start there. So we'll start here with the sodium chloride. First, before you withdraw these, you want to check them when you're getting them out of the Pyxis, and I already did that for you. But that's one check that you can do when you're withdrawing them. Another check is to compare it against the MAR. So right here we have sodium chloride, 9%. It expires on 10/25/2018, and it is to be a continuous over 30 milliliters per hour. And if you check here, those are all correct. Sodium chloride, 30 mils per hour.
All right.
And double check that expiration date. Let's see. I need gloves. We're missing gloves.
Oh, I can get you some gloves.
Thank you. Hold that here. Perfect.
It might be a little big, but
It's okay.
we'll work with what you got.
Yeah. Go ahead and put some gloves on. I'm just gonna get your band. Oh, you know what? I made a mistake. Let me go ahead and click. These scanners have a mind of their own sometimes. Perfect. Medication barcode. Verified, so that's good. The site is on his right forearm, and it is 1700, and these are my initials. And we'll go ahead and wave that up. Actually, do we have the piggyback thing? Oh, here.
It's a piggyback.
Piggyback. It's a. Since I already know we're going to be hanging this as a piggyback in the after this, I'm just going to go ahead and skip a step.
Makes sense.
And you want to hang your primary line on a lower level. So with lines, they're usually a little more neater, but we work with what we got here. Go ahead, this is sterile, so you want to make sure you take it off and don't let it touch anything. It's really in there.
Your golf tee is stuck. You know, we need to
Yeah.
see if we can.
Steven, you look like you have muscle.
Holy cow. Wow.
Would you like me to try?
We can always get another bag.
I feel like you're pulling on the bag itself too.
I don't think so. There, maybe do that. There you go.
How is this at?
Let's go again. Mine's on this one. Good thing we have lots of saline sitting around here.
That one's stuck too.
Mine's not stuck.
I think it melted to the tea.
Okay.
Perfect.
There you go.
Okay. Go ahead and spike it. And then I already checked that it was clamped. Well, so that's a part you want to make sure it's clamped.
Mhm.
And then you go ahead and fill the chamber halfway. Perfect. And then you want to do this thing. It's called priming the lines to make sure that the patient is not receiving any air. So we'll go ahead and make sure everything is open.
You got some active bowel sounds going on over there.
It'll be good for listening later.
Come on. Literally all open. It must be stuck
Is
somewhere.
the line melted together?
Yeah. Okay, so in a perfect world, we would go ahead and prime this line. We will go ahead and pretend that is completely primed.
Just explain what's going on so somebody doesn't like mark you.
Yeah, so when you prime the line, you're just going to make sure all the air is out of the line. Obviously, I would not leave the line like this, but we're just going to, for this purpose, pretend like it is completely primed. I'd go ahead and clamp it. And I'm going to go ahead and check and assess the patient's IV site, because you don't want to ever plug in any type of fluid without assessing it and making sure that his IV site works. So we go ahead and scrub the hub for 15 seconds. And while I'm scrubbing the hub, I can see that his IV is good. There's no swelling. It's intact. So hopefully it flushes well, and then we'll be on our way. Beautiful. Go ahead and leave that here. Tastes funny.
Tastes funny.
I get that a lot.
On the same hill as that thing.
So this thing, I'm glad you asked. I was about to explain it. It's called a dial-a-flow. That's an old-fashioned way of how to set lines and to make sure that they're running. So we'd go ahead and check that everything is in fact open, all the way up our line. Everything is open. Go ahead and run this. And it was at 30 mils an hour. So if you look at this thing, it's really cool. It's really simple. You just want to open it. And you 30. See?
Yep.
Perfect. And then you want to, of course, assess that you have 5 drops in here. But we already know that the line is broken. Oh, there we go. 1 drop.
Hey, look
2
at that.
drop. 3 drop. 4 drop. 5 drop.
Wow, it's working.
Perfect.
All right.
So that was set up. So we can go ahead, if you want to take a look at my screen real fast, we'll go ahead and click save. Okay, on to the next one, which we're going to go ahead and hang that Vanco. Can I have your ID, Dan?
Of course you can.
Just for the purposes, name, age, allergies.
My name is Levi Restivo. I'm 67 years old. I'm allergic to tetracycline, dog hair, and Don Schultz's terrible cartoon, The Peanuts.
Okay. Perfect. Mine's on there. Go grab it.
The tea was out of it.
It's okay.
Maybe that.
Okay, so while we're scanning it, we can go ahead. Sometimes these scanners can be super sassy. So we'll check that it's verified. We want to also go ahead and compare it. The expiration rate is good. It's 10/2018. It's the right rate, 1,500 milligrams, IV piggyback. It's 250 in 2 hours. So we're going to go ahead and do it 125 per 1 hour.
Sure.
Is that correct? Those
Yep.
calculations make
Makes
sense to
sense.
you? Okay, good. So that's what you'd want to do if a med order happened. These are all correct. It's an IV piggyback. We're giving it at 1,700. And these are my initials. I go ahead and I'll save it afterwards. But we would go ahead and hang this. Making sure that it is also clamped. So with antibiotics, you even want to be more careful with priming the line because it's a smaller dose, so we don't want to waste any bit of it. So I'll show you the way that I do it. There's 2 ways to do it, but we'll just see my way first. Again, fill it halfway, and then just slowly let it go through the line. So we don't want to waste any bit of this.
Mm-hmm.
Have you ever hung an IV piggyback before?
Oh, yes.
So you know.
I mean, we're on level 1. No, I haven't.
You'll get a pro at it. So it is almost at the top.
You don't have to dream about hanging antibiotic.
Yeah, I feel like I've done it a whole lot.
Okay,
Let me tell you.
perfect. So then I would scrub this hub for 15 seconds as well because it's an external port. I'm being very messy. We'll clean up my mess in a second. Scrub this. Women.
Close enough.
Did it make it? Probably not. It might work. So we'll still examine the line. Everything is, go ahead and let me switch the rate of which it's flowing. Again, you agreed with me it was 125, so we're just going to change the rate. And that's per hour.
Mhm.
So it's set.
Looks good.
Go ahead and reassess the line, make sure everything is open, and then go ahead and open up that. Right, and you can see that it is checking along. Nice and good.
Yep.
There it goes. So he's all set up with the IV. Do you have any questions with that?
No.
Okay. Before I forget, it's very important. I don't think I have a pen. I can't take these gloves off. I'll get a new pair. You want a name? You want to initial and date it
This is 10th.
because we want to make sure you're changing these lines every 24 hours or depending on the hospital protocol. It just kind of depends. But for us, it's every 24 hours, especially because it's Vanco. We change the lines even more frequently. And we would go ahead and initial both lines because they're both individual. So
Alright.
that is all set. Go ahead and come back over here.
You put the rate on that?
Hmm?
Just put the rate in there?
I don't, it's already, I think it's already in there.
Oh, yeah, it is in
Because
there.
it's infusing over
Yeah.
that. These things are really smart. Okay. Trucking along. Insulin. So with the insulin, do you remember me telling you that he had a blood glucose of 270 and 290?
Mm-hmm.
So what's really interesting is we can swipe over this, and this is what you call a sliding scale.
Mhm.
You'd want to monitor this, and you would give a certain amount of insulin based on that. So you can see he fits in here. So we're going to be giving him 16 units of regular insulin. We'll go ahead and do that. Name, age, allergies, please.
My name is Levi Restivo. I am 67 years old. I am allergic to tetracycline, dog hair, and oh look, Charlie Brown missed the football again, peanuts.
Oh, goodness gracious. Okay, so while we have this in our hand, we'll go ahead and check the expiration date, which is 10/25/18. It is regular insulin, and then we'll go ahead and pull it up. I need a pair of gloves again. Thanks. Do you have any questions about this, or you're okay?
What are we doing?
I'm going to be giving you your insulin
Oh, okay.
injection. Do you have a preference of where I put it?
No, you put it, I usually go in the belly.
Belly, okay. We will go in the belly too. Oh my goodness. So, one of the first steps you want to make sure you do is scrub the hub of the insulin. 15 seconds, of course. And while that's drying, you want to pull back 16 units.
Looks great.
Thanks. Go ahead, uncap your needle. Be very careful. And pull back. Can be a slow
Those
process.
needles are awesome.
Perfect. No
That looks
bubbles,
like
my
16
first
to
time.
me.
Check it. You feel good about it?
Yep, I agree.
16.
I concur
Thank you.
in my expert medical opinion.
Mm-hmm. Go ahead and take it out. And in this case, we're not going to recap it since we're just going to walk straight to the bedside of Mr. Levi. And we're going to go ahead and inject it in his right lower quadrant. 90-degree angle. Insert. Beautiful. And I think is this the one that you can push forward?
Yeah, if you push it till it clicks and then pull it back, it'll pull the needle back. There you go.
There it goes. And then immediately put it in the sharps tray without recapping.
All right.
Clean up my area. One last thing we have, Mr. Levi. We gave it a 1700.
Right upper quadrant.
Mm-hmm. Feel good about this. Everything's in.
Yep, looks great.
We will save it. Perfect. Last but certainly not least is his lisinopril. So with lisinopril, they want us to be contacting the pharmacist if we have a discrepancy in meds or have questions about crushing it or anything. But with this med lisinopril, we do not. The pharmacist said we're fine. We don't have to crush it, split it, anything.
Oh, you're in there.
Well, of course. My mistake.
Yeah, there you go.
Verified. Perfect. So while I have this med in my hand, we would again check the expiration date, 10/2018. One by mouth, and it is a 10 milligram tablet. So he gets one tablet. That's correct. We're going to be giving it at 1700. And he has no problem swallowing. I already assessed him earlier. His gag reflex is good, so we don't have to do any special measures for that.
Okay.
Give him some invisible water and let him take his pill. Okay. This is your lisinopril. It's your blood pressure med.
Okay, it looks like a Smartie.
Go ahead and take it
Okay.
for me.
All right.
Perfect.
Different manufacturers' pills can look
That's
different.
very light tasting water.
It's very light. Okay, come over here. Click save because we went ahead and gave it. And we are all good for the med pass. So Mr. Restivo, I taught you a couple things about your Vanco. Do you remember anything that you could teach back to me?
Well, I understand most of these words.
Okay.
I know I gotta watch out for being red.
Yep.
I don't want to be red.
You do not want to be red.
Should probably tell somebody if I'm having chest pain
Mhm.
or if I'm feeling weak or dizzy.
Those are all perfect points to learn and to know. I'm going to let you keep that, so when you go home, if you start feeling those or in the hospital, you let me know. I have to finish charting, so do you have any questions, student?
Yeah, I do.
Okay.
You answered most of these when I asked you the questions the first time, but I'm just going to blast you with these real quick.
Go for it.
Are there any pertinent pieces of information you review before administering the medication to the client? Sorry.
Go
And
for it.
if so, did that affect your decision to administer? And does it affect how you administer it?
So for the Vanco, like I talked about before, I went ahead and looked at his peaks and troughs and his BU and creatinine, and all of those looked good and normal. None of that information affected the way I was going to give it or how I gave it. If anything, it made me want to give it because he still does have that infection and shows signs of infection. So for Vanco, he was all set and good. For his insulin, I went ahead and we both reviewed that he had that blood sugar of 290, which is why we looked at that sliding scale, and that did affect how much we gave. So that's why we gave that 16 units instead of 12 or 14 or whatever the doctor's sliding scale was ordered. But other than that, it only affected how much we gave, not how we gave it. And then for the lisinopril, we went ahead and checked his blood pressure beforehand, and the tech told me that it was normal. We have it on here that it was charted at 132/70, so that is an acceptable blood pressure. It did not make me not want to give it, and the route, we checked with the pharmacist, and he could take it with an oral tab, which he swallowed fine, and nothing was affected with
Alright.
that.
I don't think I have any more questions. I'm just gonna wash my hands and leave the room.
Okay. Mr. Estivo, do you need anything? Do you need your call light?
I would like my call light, please.
Call light? Okay, I can try to find it for you.
That's okay. Oh, here it is on the side of the.
Oh, there it is.
Oh, there it is.
Perfect. Okay, you call
Yay.
us if you need us, and me and my student will be in the hallway charting, okay?
Okay.
Okay, I will see you later.
Bye.
Bye.